Funding for Decibel is provided by Texas Mutual Insurance.
Good evening, I'm Judy Maggio, and this is Decibel. Texas is the uninsured capital of the country. More than 17 million people here have no health coverage. Tonight, a look at why nearly 1 in 5 Texans lack medical insurance and how it affects health care for all Texans.
I think Texas is going to have to grapple, ultimately, with what's going to happen with its uninsured population, which means that Texas has to come up with its own solution, yet to be determined.
Black women are 3 to 4 times more likely to die from pregnancy complications than white women. Find out how a group of black mothers in Austin has started a movement to save lives.
Hopefully, we develop a generation of providers who are more willing, more able to listen to black mamas like Serena Williams, like Beyonce. When they say there's something wrong, there's not the instant, no, I'm the physician or I'm the nurse, I know best.
And what happens when these unsung heroes of nature need nurturing to survive? Meet an Austin couple devoting their lives to giving bats a second chance.
We definitely feel like these bats are family, and that's one of the things that makes it hard to lose them if something happens.
Those stories and more on tonight's Decibel. We begin with a dire diagnosis for Texas. We lead the nation in the number of people without medical insurance. Blair Waltman-Alexan looks at what's behind the numbers and how it impacts health care for everyone.
Oh, beautiful. Awesome. Happy planting.
Meet Margo.
I'm Margo Piper. I'm the development director at Tree Folks.
Margo really loves her job.
Tree Folks! I've been a huge follower of Tree Folks since I was a kid. In fact, the first time I interacted with Tree Folks, I was 7 years old and planted peach trees along Town Lake. Do you guys need some stickers over here? Dun, da, da, da. And it just happened perfectly to align with, a career break for me.
It was a seed of hope sprouted out of a drought of bad luck. Margo was on a break because she was recovering from a fight with cancer, a fight she had to go through with little medical assistance because she didn't have health insurance.
I was playing a time game with myself of how long can I pretend not to be sick to get full-time health insurance, and that I ran out of time.
Margo was just one of millions of Texans without coverage, and it nearly cost her her life. So how did we get here? And if you're someone like Margo, where can you go for help when you don't have insurance? First off, a diagnosis. How healthy is the state's healthcare coverage?
We are an extreme case.
This is Ann Dunkelberg with the Center for Public Policy Priorities.
Texas has both the highest number of uninsured residents and the highest percentage. So it's not just because we're a big state, it's also the highest percentage. So we have the latest census data, which are for 2018, that we had around 5 million uninsured Texans for that year. And that was 17.7% of our population. And the national average for uninsured is 8.5%. So, over twice the national average.
5 million Texans lack health insurance. That's more people than the entire population of Louisiana.
When I first started writing a paper about the uninsured in Texas, 25 or 30 years ago, we had very little manufacturing, we had low organized labor. None of the factors that would tend to drive up a culture providing a lot of employee benefits were there. And of course, employer-provided coverage is by far the number one way Americans get coverage. Now, over the last 30 years, employer-sponsored health insurance has declined everywhere, including Texas.
Y'all want one of these?
Margo had health coverage through her old job, the same job she thought was making her sick.
Living on airplanes, living in hotel rooms, and not having a lot of downtime. I hadn't had a period in over a year. I just blamed everything on stress. My thought was, Once I get out of here, I'm going to be able to focus on myself.
She left her job, but her health did not improve.
What I came across was that doctors would hear me out, and I would ask for a deeper dive, and they would say, well, let's wait until you have insurance for that. They would say, well, you'll live through the weekend. Come back Monday, which eventually, as we found out, was not going to be true at some point. I was not going to live through the weekend. I had a big meeting. Somebody looked down and they said, oh, Margo, I think you spilled some coffee. Then we looked down and I said, oh, I'm so sorry, that's actually blood. It's not coffee, it just happens sometimes.
Margo eventually found a doctor that would take her on without insurance. She was diagnosed with ovarian cancer, and the tumor was growing rapidly.
It was on the verge of what they call a dandelion effect, which means any wrong movement could have burst and the cancer would have spread across my entire body. And I was just up against that timeline. They found the cancer and it had not spread yet, which is fantastic. I mean, that's the best case scenario. I absolutely was surprised by the scenario of walking in, being treated like a normal patient up until the health insurance coverage portion. They would give me, a pamphlet with resources of, here's where you can go to get help, which I appreciated, but I also needed help now.
We are one of only 2 places where in America today, if you are uninsured, you can receive health care and be assured that you're not going to be turned away. The other place is an emergency room.
This is Rhonda Mundhenk. She's the CEO of Lone Star Circle of Care. They're one of the few backstops for Texans without health insurance. She says that there are a lot of myths about the uninsured.
I think the myth that we tell ourselves in America is that the folks who don't have insurance are not working. And the reality of it is the vast majority of people are actually working who are not insured, particularly in cities where there's sort of a heavy entrepreneurial side of business, where there are a number of small businesses still operating in a number of our counties. Those are the uninsured folks that we see. What Lone Star provides is comprehensive primary care services, but obviously if you need specialty care, which many people do for the chronic conditions that they have, that can be very difficult to obtain, depending on whether or not you can pay for it.
For Margo, even having the money to pay for tests wasn't enough to get some doctors to run them.
So my husband and I actually had been saving pretty much 10 years to buy a house. We did end up dipping into it. We had the money right there in front of these doctors, and because there wasn't the stamp of healthcare, they were just unwilling to go there.
Here's where money becomes a double-edged sword. Higher incomes offer a safety net, but having those funds is one of the reasons Margo and thousands of other Texans fall into the healthcare gap.
You qualify for subsidies if you're at a certain certain percentage of the federal poverty level. So subsidies are based on your income from 100% of the federal poverty level to 400% of the federal poverty level. And below or above that, you don't qualify.
Corey Hadimer is with Foundation Communities. Every year, they help people buy insurance through the ACA marketplace and apply for subsidies. But there's a problem. Texans who make too much money to qualify for Medicaid, but not enough to get subsidies, are left with coverage options that are usually unaffordable.
For some clients, it's just understanding, okay, I need to earn this much this next year to qualify for subsidies. And so we do the very best we can to help them get an accurate estimate for this next year. And understanding that, if you think you're gonna make $12,000 and if you earn $500 more, you're going to qualify for subsidies, having that conversation. But if people aren't close to qualifying, then it's a conversation about local options.
So how did we end up with a massive gap in healthcare coverage? There are 2 big reasons. First,
Texas will not be participating in Medicaid expansion.
Politics.
We've made policy choices that dramatically add to our uninsured rate. We're one of only 14 states now that hasn't done what gets sort of glibly called the Medicaid expansion under the Affordable Care Act. And so we have a Medicaid program in Texas that if you are working poor, there's just not a place for you.
It's just become a hard political sell.
This is Jim Henson, director of the Texas Politics Project. He says the second reason Texans didn't expand Medicaid has less to do with red or blue and more to do with green.
Anytime you're talking about Medicaid expansion in Texas, because of the high uninsured rate in the state, and just the number of people in a state as populous as Texas, you're always talking about just big whole numbers, billions of dollars in additional funding. There was just no oxygen and no negotiating room in Texas compared to other states because the price tag was so large and the political climate was so overdetermined in Texas, again, by the rise of the most conservative wing of the Republican Party.
According to the Episcopal Health Foundation and the Kaiser Family Foundation, 2/3 of Texans say the state isn't doing enough to help low-income adults access medical care. But even in an election year, Hinson doesn't see things shifting for healthcare in Texas.
Healthcare doesn't really move the needle very much. And Texas has been one of the states leading litigation to get the Affordable Care Act repealed. So there's really no political leverage to say, well, we think the Affordable Care Act is unconstitutional. And they say, but we'll take Medicaid expansion.
But experts say Texas can't afford to stand still. By 2040, the uninsured population will rise to over 6 million people, costing the state an estimated $2 billion.
If we are serious about really creating an opportunity for people to move their way up the economic ladder, we haven't done that until we have a system that provides economic safety for people in the healthcare realm. So that's a huge disadvantage to low-income Texans, and it falls very, very disproportionately on people of color in Texas.
I think Texas is going to have to grapple, ultimately, with what's going to happen with its uninsured population, which means that Texas has to come up with its own solution, yet to be determined.
Oh, the handoff is official.
Today, Margo is doing well. Her cancer is in remission, she's passionate about her job, and yes, she does have healthcare coverage. But she's also aware that with a few less resources, her story might have ended very differently.
It was not a fair system. That was the most disheartening thing, and I know not everybody has the cash in hand to be able to do that, which was also terrifying to think of somebody who really did need the help and didn't have those advocates.
Here's another gap in healthcare. Black women are 3 to 4 times more likely to fall victim to America's maternal mortality crisis than their white peers. Pregnancy complications for high-profile mothers like Serena Williams and Beyoncé are finally calling attention to the real risks of childbirth for Black women. Here in Austin, there's a nonprofit on a mission to save lives through educating, empowering, and advocating for Black moms.
The mission of Black Mamas ATX is to prevent Black women from dying during and after pregnancy. We want them to not only live, survive, but we want them to thrive throughout the pregnancy and postpartum period.
You see all the new faces?
3-month-old Nia is the newest addition to the Avery family.
Are the kids happy, babe?
Sleepy still.
Sleepy still.
The Averys have 3 other young children, so life is busy.
It's kind of hard to juggle, taking care of yourself, taking care of a new child. And I have other small kids too, so juggling all of that.
Juggling is easier with their 4th child because before, during, and after Nia's birth, Cornelia and her husband had extra help from their doula.
And so a doula is someone who provides emotional support, labor support, resources for the mom, just overall like that extra care for the mother, the laboring mom, and her loved ones, her support system.
Africa Farrow is one of 2 full-time doulas with the nonprofit Black Mamas ATX. Her work with Cornelia and the other moms they serve continues beyond the birth experience. She'll come for regular visits until baby Nia reaches her 1st birthday.
Providing those resources, providing help, just any kind of help that she needs or anybody needs. That's the role of a doula. To carry you through, to give you strength, community, and to know that you're not alone and that you have help. And I think that helps with the stresses of the world.
I trust Africa. I mean, she was there to help me birth my child. Like, that's extremely intimate, and that's extremely, talk about doing life with a person, you know, like that. Once you see somebody birth a baby, like, you know, you're pretty close at that point. So if I'm not doing okay, if I'm feeling anxious about something, I have someone who I can trust.
Having a trusted advocate and advisor can be a lifesaver. That's why the Black Mamas ATX team is reaching out to the community and spreading the word about their resources and sister circle support groups. But providing a support system for mothers is just part of the fight to lower the high maternal mortality rate. The sad reality is, even with equal economic and education levels and access to prenatal care, Black women are still much more likely than white women to die of pregnancy-related complications. Why?
What the data points to is unconscious bias and institutional racism as being a huge part of why moms are not receiving the same level of care. Specifically, Black mothers report over and over again not being listened to. So I come to you and I tell you that I'm having this pain or these symptoms. I'm telling you that I have specific concerns regarding my pregnancy and my child, and being dismissed and unheard, and that resulting in morbidities and or mortality.
Tackling unconscious bias in the healthcare system is a tall order, but one strategy is training the next generation of nurses.
Nurses they're the provider that's there the most in the hospital setting with moms. And so they have such a huge opportunity to advocate for that mom whenever instances arise of bias that plays out or they see blatant racism. The nurse can be kind of that gatekeeper in a sense, to be there to listen to the mom whenever she's expressing concern.
Dr. Danica Sumter teaches at the UT School of Nursing and works closely with Black Mamas ATX.
If we can educate future health providers and help them have an awareness of institutionalized racism, their role in the system, to be able to listen, to talk about implicit bias, how does that impact the health of their patient? Hopefully, we develop a generation of providers who are more willing, more able to listen to Black mamas, like Serena Williams, like Beyonce. When they say there's something wrong, there's not the instant, no, I'm the physician or I'm the nurse, I know best.
Black Mamas ATX is just one of the groups on the ground providing a safety net so fewer African American moms will face a crisis during or after their pregnancy. For Cornelia, the help has been a game changer. The gift of guidance and support from Africa has been so meaningful, she's now considering becoming a doula herself someday.
He's wearing big boy underwear. Yes, that is like a major milestone. Because remember when she was first born, I was like, I gotta get him potty trained.
There are systemic health challenges that impact communities of color. That's why every year, health and wellness take center stage, along with big-name celebrities, cooking, and fitness classes at the Urban Health Expo. But there's a vital message behind all the fun.
This is one positive thing that we can do every year to try and align these communities with better health and with thinking about it collectively as a group. How do we do better as a community? How do we sort of inculcate this thing that we started today and carry it on in our communities over the year until we see each other next year? You learn what you see, and you do what you learn. And so, particularly in communities of color, it is essential to sort of really showcase things that we want the community to be able to do. These communities in particular are beset by health disparities, and so those are things where you need to improve the things that you're doing. Those are things where we need to change social norms. There are lots of other reasons, obviously, that are outside of individual responsibility or context, which is why things are the way that they are and why those disparities exist. But the things we are encouraging you to do are to eat better and to exercise. Taking it one additional step and saying it is part of healthcare to engage in health, and particularly collectively, right? A lot of times people think of healthcare as an individual thing. The reality of it is, though, that it happens in context. It happens within family units, it happens within households, it happens within communities. And so really shaping those norms around what is normal, what we do want to do, what standard of health we want to have, what kind of wellness we want the community to have. Those are things that have to be done collectively, and so that's what today is about.
I was saying I've been hearing those scary statistics for a while, but it was nice to see a bunch of knowledgeable women come together to talk about it.
And it's something that takes repetition, and it's something that takes a lot of effort, and it's something that takes everything that you saw here today. It's the normalizing of these activities to say that it's not just for certain people, it's for everybody. And find the thing that you love. That's the other thing that I love about today, is that exposure to multiple different physical activities, nutritional opportunities, and the like. And it's finding what works for you at the end of the day, and it's finding yourself in those opportunities. And I think that's what's so exciting about the expo.
Finally tonight, Austin boasts the largest urban bat colony in the world. Some people find them a little creepy, but these winged mammals play a key role in keeping our ecosystem healthy. But what happens when bats face health challenges themselves? That's when an Austin couple comes to the rescue. Their work and their love are giving bats a new lease on life.
Couldn't have predicted this in a million years. But I feel really lucky to be part of it.
We were introduced by mutual friends, and at the time, in my rental house, I had some what I thought were squirrels, probably squirrels living up in the attic.
At the end of the exclusions, he said, "Well, what do I owe you?" And I said, "How about lunch?" And
so we got married in 2004. I guess almost as long as we've been married, we've been working together with bats. We've been a nonprofit for about 3 years, but we've been doing much of this work for 10 to 12 years. What we do is very different from what most bat scientists do. Bat scientists, bat biologists are almost always more involved with the bigger picture world than we are. They're involved in saving populations. We're more involved in saving them one at a time. Right now we have, I think, 73 bats at the refuge right now. Some of those are non-releasable bats that will live their lives with us. But we do still have a number of bats that are going to be released.
so we have a unique situation here. There's not many places like this in the U.S. Most other places have the bats indoors all the time in climate-controlled conditions. But we don't like doing that. We like to provide them with a natural environment. We think it gives them a better quality of life if they can hear all the insects and the birds and feel the wind blowing.
Each individual bat, even within a species, each one has a unique personality, and they're intelligent animals, and there is definitely communication between us and the bats. There's a connection. Hi there. We definitely feel like these bats are family, and that's one of the things that makes it hard to lose them if something happens.
It's the way of the world, period, and it's also the way of the world in animal rehab. You do lose animals from time to time, and since you've extended yourself like that and you've just poured yourself into them, it can be really hard, and I worry about Diane sometimes.
I feel kind of helpless sometimes. I tend to be pretty hard on myself if I feel responsible for a bat's demise or a bat's illness or injury.
It's okay. Oh, I know it hurts.
So, yeah, we're always wanting to be better. We always want to have more bats that can be released and more bats that survive, and I think we do get a little bit better every year that we do this.
How's it going?
That looks good.
We show them all the love they need, any infant needs. They love us right back. I don't care what the anthropologists say or, any of that stuff. It's clear, it's so obvious. They love you right back.
Yeah, love is kind of what it's all about, really. Yeah, we do love these bats. And we love each other. Yeah, absolutely. Even when we can't stand each other, we know that we love each other.
You want to try another? You can get her to eat one.
Nah, she doesn't want another one. She's fine.
We hope you enjoyed tonight's episode of Decibel. As always, we welcome your comments and ideas and invite you to follow us on social media. Look for more of our stories on the Decibel ATX website. Thanks so much for sharing part of your evening with us.
Funding for Decibel is provided by Texas Mutual Insurance.